Breath testing for the determination of small intestinal bacterial overgrowth, SIBO, has been used for 50 years. SIBO is determined by detecting the rise of hydrogen in a patient's breath. Because humans don't produce hydrogen, a rise in hydrogen indicates hydrogen-producing bacteria in the small intestine. Later, breath tests evolved to include the measurement of methane. Methane has been proven to be associated with chronic constipation and irritable bowel syndrome with constipation. More recently, a third gas produced by gut bacteria has been added to the breath test, hydrogen sulfide. Hydrogen sulfide is linked to inflammation and was recently linked to diarrhea-predominant irritable bowel syndrome. But how useful are these tests in clinical practice, and how well do they reflect patient symptoms? In this study, we evaluate a new 3-gas breath test across a nationwide group of subjects and compare all 3 gases to the subject's gastrointestinal symptoms. Subjects received a breath test, TrioSmart, by mail to their home to complete. Depending on the ordering physician, the test utilized either a lactulose or glucose breath test. When looking at the reasons for breath testing, bloating was the most common, with over 90% of subjects reporting some degree and 52.9% reporting severe or very severe bloating. Other severe or very severe symptoms included diarrhea, constipation, and abdominal pain. Of the 6,000 patients sent a breath test and questionnaire, 3,004 subjects had a full breath test that passed quality checks and were included in the final cohort for analysis. And here are the results. Of the 3,004 subjects, 788 were diagnosed with SIBO, while 696 were diagnosed with EMO and 297 were diagnosed with ESO. Of note, the identification of SIBO, based on hydrogen levels, was much higher using lactulose as a substrate as compared to using glucose. And now let's look at the breakdown by gas. Hydrogen levels were analysed across the full 2-hour breath test, and higher hydrogen levels were consistently linked to lower constipation. More severe diarrhea was associated with higher hydrogen levels only in the first 90 minutes. But no correlations were identified between hydrogen and abdominal pain. Higher breath methane levels were correlated with more severe constipation. In contrast, methane levels were inversely correlated with urgency of defecation and diarrhea. No correlations were identified between methane levels and abdominal pain. Higher levels of breath hydrogen sulfide correlated with more severe diarrhea, more severe urgency of defecation, and more severe abdominal pain. Methane and hydrogen levels showed an inverse relationship, meaning when one was high, the other was low. As a result, SIBO and EMO rarely occurred together, consistent with prior findings in IBS subtypes. High hydrogen sulfide levels were more closely linked to severe symptoms, especially diarrhea, than to hydrogen or methane levels. The strongest increases in overall symptom severity occurred at the highest hydrogen sulfide levels. Distinct symptom patterns were identified across the different microbial overgrowth subtypes, SIBO, EMO, and ESO. Among the 22 assessed symptoms, 7 were identified as most relevant for distinguishing microbial overgrowth subtypes, 5 of which showed statistical significance: constipation, urgency, diarrhea, pain, and severity. The presence of EMO, alone or in combination with SIBO or ESO, was associated with increased constipation and pain scores. Whereas ESO, alone or in combination with SIBO or EMO, increased diarrhea and urgency scores. When all 3 conditions co-occurred, constipation scores were at the lowest levels, while diarrhea and urgency scores were highest. Lastly, subjects with any presence of ESO, alone or in combination with SIBO or EMO, had higher scores for diarrhea, urgency, bloating, and overall severity. Subjects with ESO alone had the highest pain and severity scores. This shows that the presence of hydrogen sulfide on breath was the most important driver of symptom severity, dominating the other overgrowth subtypes. In summary, this nationwide study shows that at-home 3-gas breath testing is reliable, and that each gas is linked to specific gastrointestinal symptoms. Hydrogen is associated with diarrhea and remains important for identifying SIBO, but may be underestimated when glucose is used as a test substrate. Methane is associated with constipation, and hydrogen sulfide is associated with more severe diarrhea, abdominal pain, and overall symptom severity. These findings highlight the value of measuring all three gases, especially hydrogen sulfide, to better capture symptom patterns and guide diagnosis.